Yellow skin and itchy, the causes of jaundice. Have you ever looked in the mirror and thought, why do I suddenly resemble a red banana? Or maybe you noticed your skin itching so badly that you're reenacting that scene from The Grudge where the ghost crawls under the skin. Don't panic. Well, maybe panic a little. Today, we're talking about two medical symptoms that often show up together. Jaundice, that is yellowing of your skin and eyes, and pruritus, or itching, which is the bad accompanying symptom that makes everyone worried. The real medical term for itching should be make it stop, but here we are. These two symptoms happen for all sorts of reasons, from harmless temporary issues to serious internal conditions that need urgent care. And because this is Askadoc, we're going to break it all down. Why the skin turns yellow, why itching happens in liver and bowel diseases, when yellow skin and itching are actually a medical emergency, the weirdest medical causes of both, and how doctors figure out what's wrong. Excuse my croaky voice. Yes, Askadoc has the lurgy. So, moving swiftly on, what exactly is jaundice? The word comes from the French word jaune, meaning yellow, which is fitting and honestly not very creative. But medically, jaundice happens when there's too much bilirubin in your body. So here's the deal. Your red blood cells live about 120 days. That's 3 months. And when they die, your body recycles them. The body is the most environmentally friendly organ or organismus there is. It's a very, very environmentally friendly machine, our bodies actually. The hemoglobin inside the red blood cells gets broken down to bilirubin, which is basically a yellow pigment. Did you know that? You would think that it would be red, right? But it's actually yellow. So normally bilirubin goes to the liver. The liver processes it and it gets dumped into bile. Bile drains into the intestines and then it comes out through the bowels. So that's the life cycle of bilirubin. But when that system gets disrupted anywhere along the line, too much bilirubin is made, the liver can't process it, or bile can't leave the liver, you end up highlighted or yellow. So, how many types of jaundice do we have? In medicine, there is always more than one type of something. In the case of jaundice, there are 3 types. Pre-hepatic jaundice, this is everything that happens before the process gets to the liver stage. There is hepatic jaundice, everything that happens within the liver itself. And there is post-hepatic jaundice, everything that happens after the liver part of the cycle. In pre-hepatic jaundice, too many red blood cells are entering into the liver, so to speak. Too many red blood cells are breaking down too fast. And these are usually caused by blood illnesses like sickle cell anemia, or sickle cell disease, which typically affects people of African origin or southern Mediterranean origin. And then you have hemolytic anemia. This is what happens when a blood transfusion goes wrong, for example, where you have incompatible blood, and then one set of blood cells start attacking the other. And basically you get a battle of red blood cells, and some of them, the ones that are defeated, basically break all down. Now they all break down, and it causes mayhem, because then there's too much bilirubin being created, which the liver cannot then deal with, or can't deal with sufficiently. You can also get a special type of hemolysis or hemolytic anemia, which is actually a disease in of itself, and that's called autoimmune hemolysis. Horrible disease. It's caused by the body itself attacking its own red blood cells. As are indeed all autoimmune illnesses, the body attacks itself. Very weird. Finally, you can also get this kind of pre-hepatic jaundice with malaria, a tropical disease, which some of you may be familiar with. Bilirubin piles up because the liver is working overtime trying to process the leftovers. And then you get the hepatic jaundice, where you get a condition, usually an infection, for example, hepatitis, which causes a malfunctioning of the liver such that it is unable to cope with even a normal amount of bilirubin. Liver failure of any cause can also do this. You can also get this in something as, shall we say, almost banal as fatty liver disease. Fatty liver disease is not actually in of itself a great problem, but it can lead to all kinds of complications if it persists. So now we get to post-hepatic jaundice, and this is where something blocks within the bile duct system. This is after the process has gone through the liver, and then on exiting the liver, there are blockages. These are usually caused by gallstones or tumors, particularly pancreatic cancer. The pancreas is very, very close to the liver anatomically. Bile duct strictures, so these are severe narrowings within the bile duct system, which effectively block the outflow of bile. And then you have diseases. Again, this one is autoimmune, called primary sclerosing cholangitis, a horrible disease which causes bile to build up, leading to, and we'll come to this, itching as well as turning yellow. Just a little note, it's important to realize, besides yellow skin, jaundice makes your eyes turn yellow first. So it's important to watch someone's sclera, the whites of the eyes. If that's yellow, it's real jaundice, not fake tanning, not turmeric face masks, not oops, I used the wrong foundation shade. It's real jaundice. There has to be a problem with the liver. So what is pruritus, and why is it even a thing? Pruritus is the medical term for itching, as we have already alluded to. The irresistible urge to scratch, rub, drag your back against the wall like a bear, or debate peeling your skin off like a sticker. Itching has dozens of causes, including dry skin, allergies, eczema, insect bites, kidney disease, thyroid problems, some medications, and even stress. But in today's video, we're focusing on the type of itching that often shows up with jaundice. Itching from cholestasis. Cholestasis is when bile gets stuck and can't flow properly. And these are, and we've already talked about this, the causes where after the liver part of the cycle, bile gets blocked because of a specific cause, like a blockage, like a cancer, a tumor, or a stricture. Those are the causes we're talking about. These causes of bile blockages cause a very specific type of itching. It's deep, it's persistent, it's worse at night. It's worse, strangely enough, on the palms and the soles. Sometimes it's so bad that patients injure their skin scratching. In fact, pregnant women with a condition called intrahepatic cholestasis of pregnancy describe the itching as trying to scratch from the inside out. Yikes. That's pretty bad. And it's one of the most unpleasant symptoms to have. So, when yellow skin and itching show up together. Now, this is where things get interesting, because when you have both jaundice and itching at the same time, it often points towards specific medical conditions. Number 1, of course, on this list is bile duct obstruction. Gallstones, cancer, tumors in the bile duct region, cholangiocarcinoma, scarring, called strictures. So, here you have yellow skin. You also, by the way, have pale clay-colored stools. Very, very distinctive. Dark urine, which kind of looks like Coca-Cola almost. Severe itching and sometimes abdominal pain if the cause is gallstones or in certain tumors. So this combo is called obstructive jaundice, and it's a medical big deal. It's an emergency. So, just very quickly, let's talk about certain drugs that can mimic this. Anabolic steroids, for those of our brothers who like to buff up at the gym, who abuse steroids, be very, 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 very cognitive of this particular side effect of steroids. They can do this. They can cause drug-induced cholestasis. Certain antibiotics like augmentin, coamoxicillin, these can also lead to cholestasis. Many anti-epileptic medications can do it. The pill for the young ladies, remember, the pill can cause this type of liver problem, so be very wary. Some psychiatric medications as well. There are rare genetic disorders that can do this. I'll just quickly mention them. They're called Dubin-Johnson syndrome, or you have another one called Rota syndrome, and another one called progressive familial intrahepatic cholestasis. But these ones are usually diagnosed in childhood, and they're very rarely able to present for the first time in adulthood. So let's just touch on one particular cause of cholestatic jaundice, which is a very sad one. This is pancreatic disease, usually inflammation or tumors, right? And these can physically cause an obstruction of bile flow. The patient then has pain because pancreatic tumors actually tend to be very, very painful. The tumor has very little space in which to expand. So very quickly you develop pain just simply because there isn't much space. Unlike other tumors where the organ has much room to maneuver, so before you start feeling pain, the tumor has already pretty much expanded to advanced levels, which then start to cause pain. But pancreatic tumors cause pain early. They cause weight loss very quickly also. Severe itching and jaundice are very, very quickly symptoms that hopefully bring to light the problem. How do doctors diagnose cholestatic jaundice? So let's say you walk into the clinic and for some reason you are clear enough to say, hey doc, look at me, I'm yellow and itchy. Your doctor would be able to see it, of course, at least see the yellow part. But if you go with these two symptoms, there's a whole bunch of history taking. Now, history taking is what the doctor asks you. The doctor will ask you when your symptoms started, which medications you might be taking, do you drink alcohol, and if so, how much? Have you been to any exotic places lately? For example, in certain tropical countries where hepatitis is endemic, or where you may have had issues with water pollution, it's all part of the history taking. Very important for the doctor to know. If you've had any recent infections, any abdominal pain, any weight changes, any family history of illnesses, has your stool or urine changed color? What kind of itching do you have? Is it worse at night or worse during the day? Are you pregnant? And have you had any exposure to hepatitis? And then, of course, the next step will be a physical examination. The doctor is specifically looking for Yellow sclera. The whites of your eyes, are they now yellow? Is your liver enlarged? And the doctor can tell by examining your abdomen. Do you have skin scratch marks? Do you have what we call spider angiomas, little spindly red net-like lesions on the skin? They kind of look like red spindly-like marks. They're called spider angiomas. They're one of the signs of liver disease. Do you have fluid buildup in your tummy? Are there signs of chronic liver disease? And these are easy to look for. The doctor might also check for what we call Murphy's sign, whereby they press under the right rib cage and seeing if you wince. It's a specific sign which may tell the doctor about the presence of gallstones, for example. After the physical exam, you then get blood tests and also imaging tests. So the blood test would be, of course, bilirubin levels, other liver enzymes, what we call cholestatic markers, something called GGT and ALP, all very technical stuff, but just to give you a brief idea of what the doctor is looking for. The doctor would look to check that your liver doesn't, that your blood doesn't coagulate easily. They do a special test called an INR test. They check your albumin levels, total protein levels in your body, because this is where the liver is where albumin and protein are produced. The doctor will look for your blood count, red blood cells, white blood cells. They may also look for autoimmune markers. They'll do hepatitis tests. They will check also the structure of your liver by doing an ultrasound, CT scan, MRI, MRCP, and ERCP. These are specialized tests, imaging tests that may require to be done so that the diagnosis can be made very quickly just by looking right at the images on the scan. And then you have some specialized tests like a fibroscan to check for liver stiffness, to see if you have fibrosis, a liver biopsy, maybe even some genetic tests. So the moral of this video is it's always a red flag when you have jaundice, yellow skin and eyes, and itching together. It's a medical emergency. And it's important that you don't ignore this. It is a serious problem. Go to the emergency room, your A&E department, immediately. If you have sudden jaundice, especially with severe abdominal pain, especially if it's combined with fever and chills, maybe if you have a bit of drowsiness as well, confusion, certainly if you're vomiting, if it's rapidly worsening, you're getting dark urine, your stools are turning a light color, you're losing weight, and for sure, if you're getting jaundice during pregnancy. There is a classic triad that doctors are trained about, and this is fever, jaundice with right upper abdominal pain. So just under your rib cage on the right hand side, if you have pain there, if you have fever, if you have jaundice, there can only be one diagnosis, and that is cholangitis, an inflammation of the bowel canal. If you also have confusion and low blood pressure, in addition to this classic triad, well, that's septic shock, and you need immediate medical attention. So, just to recap, in the event of having itching with jaundice, the earlier you get evaluated, the better the outcome. Always take it seriously. Although many causes are treatable, it's important to start the treatment early. This is why I said at the beginning, yes, you may panic a little bit, and that panic will, of course, get you to go and see a doctor. This is good panic. But know that the condition is mostly treatable, unless, of course, it's really bad news like pancreatic cancer. If you enjoyed this deep dive into the world of bilirubin and bile acids, and if you learned something that will help you or someone you care about, hit that like button, subscribe, leave a comment. What topic do you want to see next on Askadoc? I give you the vote. By all means, let me know. Thanks for watching and stay healthy.